Chances are you or someone you know has shoulder pain. Is it you? Maybe somebody you know. Either way, by watching this video, you may be able to help yourself or somebody else. Today, we are going to be going over tendons and ligaments and the rotator cuff within the shoulder pain. With me, I have Dr. Earl. How are you?
Doing great, thanks.
Good, good. A little background on Dr. Earl. He has been working in emergency medicine for 16 years, which then pushed him into regenerative medicine for the following 12 years. He is the owner of Denali Medical, and he lectures nationally on regenerative medicine. And today, like I said, he's here to talk with us about that rotator cuff and the tendons and ligaments. So I guess that leads me into what type of injuries would tendons and ligaments differ from the rotator cuff? Or how are they all combined?
Right, great question. And sometimes that can be really confusing. So the first thing we need to understand is that the shoulder is amazing. It's the joint that has the most motion and possible motion within the human body. In almost all the planes, it can move 180 degrees around that shoulder joint. And so because of that, it can be very complicated. It has a lot of structures that allow that kind of motion and allow it to do that motion in a stable and predictable fashion. So bones, muscles, tendons, ligaments, and what have you all make up that shoulder joint in order to allow it to have that kind of motion. Well, a couple of components that make up that stability are the ligaments. So ligaments are a fibrous connection between bones. So when bone connects with bone, then that's called a ligament. And we have that, for example, at the acromioclavicular joint, something called the AC joint. There's a ligament in between there. And there's some other ligaments around the joint that can help stabilize those bones as they move around. Most importantly, though, there's a lot of tendons from different muscles around that shoulder joint as well. So the difference between a ligament and a tendon is a connection between a muscle and the bone. Well, there's a group of tendons that surround the shoulder joint in a cuff-like fashion, and we call it the rotator cuff, but it's made up of a series of tendons. And so knowing the difference between the ligaments and tendons and sorting out where your pain is coming from can be very, very important. Understand, though, that because of the complexity of the shoulders, sometimes getting exactly where that pain is coming from can be difficult. So getting an appropriate diagnosis can be very important.
Good to know, especially with all those moving parts in that area with the tendons and the ligaments. Why would this be a problem more so down the road should you have trouble finding those harder places that are causing pain initially?
Well, the big issue as far as the rotator cuff is concerned is that each of those muscles provides a very important function. And so if you don't have that muscle or that tendon functioning the way that it should, it causes pain and or dysfunction. And the other muscles and ligaments have to make up the difference or try to make up the difference. And so they get compromised and worn down over time as well. And so that's why it can be a very significant problem as far as if they're not functioning the way they should, it will lead to increased pain. It will lead to breakdown of the shoulder, not only the shoulder rotator cuffs, but also the joint inside will start to break down because it's rubbing abnormally within the capsule. And so getting that balance can be very important.
Good to know. So it sounds like those could be some serious injuries. What would be the options for care for the rotator cuff itself, or even just tendon injuries that are within the shoulder?
Well, the biggest thing to differentiate between rotator cuff injuries and ligament injuries is that knowing whether it's a complete or partial tear. Complete tears typically, not always, but typically require surgical repair. So imagine, if you will, those tendons and or ligaments are under a significant amount of tension. And when that complete tear happens, it's almost like a rubber band where it snaps back. And so you end up with a big gap in the center. And it doesn't matter how magical or amazing the injections are, it's very difficult to get those to grow back together. In fact, usually It's not possible. So under those scenarios, typically it does require some type of surgical repair. But if you have a partial tear, the body is still able to build on that tissue and repair that tissue. It just needs good oxygen and nutrient supply to do that. Now, part of the problem after an injury is we often have inflammation that blocks the body's ability to deliver that oxygen and nutrients where it needs to go. But again, if you qualify for care or not really determines on whether it's a complete or partial tear. And sometimes that can require an MRI. A lot of times it just requires a good diagnostician.
Well, with that being said, Denali obviously has the options for those injuries. And remind me again, which ones are those again?
So we use Renew O2 and PRP-O2 to deliver nutrients and oxygen right into those tissues and really enable the body to heal itself. A big study out of Duke University came out and said the body has an amazing ability to heal. And even more importantly, the Nobel Peace Prize for 2019 was given to a team that recognized that oxygen activates 300 genes inside of your DNA. Really powerful stuff. And the reality is, we just need to use the body's miraculous ability to heal and activate that. And that's what we do at Denali. It's amazing.
Sounds like it is. I'd love to find out more. And before I move forward, who would I know to refer? Who would qualify for such services that Denali could provide?
Well, we have a really reasonable consult opportunity at Denali. So if someone's really curious, just have them come into Denali and we'll let them know how available their injury is for repair with the things that we do at Denali. We can do imaging if required. We can review those imaging, the images that you already have. There's a lot of different options that we can do at Denali as far as helping you move forward and sort out what your best options are.
That sounds awesome. Well, I'm ready to heal. I don't know about you guys. So where would we go again if we were wanting to get started?
Well, the best place is go to denalimed.com. You can find out some more information. The phone number for contact is there. And you can also see some additional tools as far as making a choice as far as what might be best for you in getting your body healing and getting you better.
Perfect. Well, again, that was denalimed.com. If you'd like to learn more and want to get started on your healing, please feel free to give us a call and we'd be happy to help.